Welcome back to Ramble On, conversations and reflections from my counseling perspective, all things life and love. Today is a bit of a hot topic. I will say right away that I'm not a psychologist, I'm not a psychiatrist, I'm not a doctor. I have a master's in counseling psychology, and I've worked with clients and youth and through the school system and through my work. I see things and I hear things, and in my professional experience and in all the things that we know about mental health, I like to put the pieces of the puzzle together. So today we're talking about self-harm and also its connection to ADHD, in particular with girls and women. Okay. So self-harm in young girls is often linked to anxiety, depression, low self-worth, lack of confidence in today's day and age of social media, and all the comparisons that they're making to, what they should be and what they're supposed to look like. And on social media, it can be very hard for young girls to be confident in their own identity, in their own selves. And at an age of, young teens and teenagers and youth, when you're in a developmental stage of life where you're exploring your identity and you're learning about who you are, and you're trying to get that solid footing grounding of being out in the world and being comfortable with yourself as your body is growing, your ideas are growing, you're learning at such a rapid pace. You're becoming more aware of the world around you. In elementary and primary school, at those younger ages, you're less working on your identity as you are being a child and playing and playing through the world. But now, as you get into teenagehood and teenagers, you're more looking at the world from a perspective of how do I fit into it. So self-harm can be anything from, we often think of self-harm right off the bat as cutting. It can also be picking, hair picking, skin picking. It can be, self-harming with drugs, alcohol. Also, choosing toxic relationships is self-harming, self-sabotaging. Anything that really causes harm to the self. So when I say self-harm, as parents and educators, we first think of like the physical sort of, again, cutting or picking or burning or those kinds of things. It does encompass, the psychology behind it does encompass all things that are self-harming. And what I mean by that is they're all connected to how we view ourselves, and the purpose behind it is connected. So for parents, it can be scary and hard to see that your child if you discover that your child is self-harming at any age. It can be very hard for parents to understand that and have conversations around that. And sometimes there's some myths around it. Parents immediately will think, well, my child is suicidal, or they might be attempting to take their life. Self-harm is not directly trying to take your life or having ideas around suicide, while the risk for those ideas around suicide can be higher if that child is experiencing depression and anxiety. It's more about the depression and anxiety. The self-harming is sort of a separate thing that is not an attempt of suicide. Okay, but it is certainly something that is worth having a conversation around if your child is experiencing extreme depression and anxiety. So we live in this world where, as women and girls and boys as well, I will say that while, from what I understand in my research, is boys are also self-harming, but the prevalency among girls is higher. So we're talking, the studies on this are fairly recent, but we're looking at about 70% girls, 30% boys, depending on what literature you're reading. And so the idea is essentially it's an externalized behavior from internal thoughts and conflicts. Okay. So, what is self-harm at its core? Why do we do it? What is the purpose? Okay. It's a coping mechanism. It's a strategy or a tool to regulate when we have those overwhelming emotions. It's a way that we can feel something physically, right? We can feel that harm, even if we're choosing drugs and alcohol. That can be also a high or a dopamine hit, but also it is self-harming. Toxic relationships, when we think about that as a self-harming behavior, we're looking at the highs and lows of being treated poorly by a partner and then being treated well by a partner. That cycle of toxic relationships is usually high and low. And that can increase the dopamine. And it's also a source of, again, stimulation, emotions, feeling. It allows us to feel something. So when we are experiencing depression and anxiety, it's like we can control how we feel in those ways by making ourselves feel bad, but it is a sense of control. So it's sort of a way to express the pain that we have internally without words. Okay. Again, I'll mention this as well for parents. It can be scary. I encourage you to reach out to a counselor or a professional to talk about it if you're concerned about your child, or if you discover that your child is self-harming. Have those conversations with a counselor and ask, what's the best approach for my child? Self-harm is about relief, not about wanting to die. Okay. And again, I'm not saying that suicidal thoughts and tendencies that child could be experiencing those as well, but it's not necessarily directly connected to the self-harming behaviors. Okay. Certainly something you want to consider. Some of the myths around it too, I know we like to say, oh, they're just doing it for attention. They're just seeking attention. They're being dramatic. It's trendy now. It's on social media. It's like, how do I get attention from my parents or from teachers? I'm going to self-harm. Generally, that's not the case. If a child is self-harming, there's more to it. So I would, saying things like, well, I don't want to talk about it. Let's just push it under the rug, because if we talk about it more, they're going to do it more. That's not the case either. Or, saying things like, well, just stop, like, just don't do it anymore. It's not as simple as that either. You see your child maybe sitting on the couch. I know a common one for young girls is pulling hair. Okay. Like pulling little pieces of hair out, because you get that sensation in your scalp, right? That little bit of stimulation. You see your child sitting on the couch pulling hair, and you're like, just stop, stop doing it. It's not as simple as that. Okay. And it's not a quick fix either. Parents will often feel, again, scared, guilty, helpless, very normal reactions. But again, speak with your child about how they're feeling about life in general. That's a good place to start. And we'll talk about treatment and support in a minute. But I first want to address, some connections to why young girls might be self-harming, something to consider. There is a link between ADHD and depression, anxiety. Those things that come up in young girls and women are often linked, not always, to ADHD. ADHD in girls and women is highly underdiagnosed. For years, all the research and all the studies have solely been around boys and men, because their behaviors, usually in the academic environment, in school or at home, will be externalized. So they'll be bouncing off the walls and inattentive in school, and being troublemakers or not being able to focus on their schoolwork, highly impulsive, reactive. And it's easy to see ADHD in boys when it's an externalized behavior. It's more of a red flag. In girls and women, we internalize our thoughts and our overthinking and our lack of self-compassion. One of the biggest struggles women have with ADHD is beating themselves up every day. I'm not good enough. I'm not pretty enough. I'm not smart enough. I just can't do it. I don't deserve a healthy relationship. All those thoughts, those lack of self-worth that we have internalized don't often show on the outside. Self-harm is one of those ways that it can show on the outside. So the connection between self-harm and ADHD in women and girls is finally starting to be studied and looked at. The underdiagnosis of ADHD in women over the years has now led to women my age in their 40s and 50s going, I treated myself pretty poorly for my whole life. A lot of overthinking, not being able to focus. Maybe I have ADHD, and there's a lot of late diagnoses happening now. So here in Newfoundland, so we talk about ADHD diagnoses, and while I know there's a lot of stigma around, well, like everybody has ADHD now, they don't, but it is becoming more prevalent because it is connected to, again, it's a list of boxes that we check off, to meet those criteria during an assessment. And a lot of those boxes overlap with other things. So it can be tricky. Is it trauma? Is it, for older women, is it menopause? Is it PTSD? Is it like what's going on here? But regardless of the label or the diagnoses or like how many boxes are checked off, we need to look at what that person is experiencing. Where is the harm happening? And where do they need support? So girls with ADHD who possibly might also be self-harming, the support and the treatment comes from talk therapy, CBT, DBT. Those are types of therapy, dialectical behavior therapy and cognitive behavioral therapy. Those are modes of talk therapy where you're looking at your internalized thoughts and trying to change your perspectives around those so that you can feel more confident and dig into your self-worth. Medication for young girls who are experiencing self-harm, being medicated for ADHD can bridge the gap to getting to that place where they feel more comfortable trying new things. They'll have less anxiety and slowly build that confidence. Medication's not a magic pill. I am not anti-medication, but I do believe that it's a piece of the treatment plan. So we need to look at the whole picture. Is your child getting enough physical exercise? Are they eating well? Are they sleeping? But when you have ADHD without medication, those things are even hard to get to. So medication can sometimes bridge that gap as a stimulant to sort of activate that place where, oh yeah, I can do this, right? And then you build the pieces, and counseling and therapy is also one of those pieces. Young girls having a neutral place to vent, to talk about how they're feeling, to talk about their thoughts with a professional who understands is really important. I know my teenager doesn't want to listen to my ideas and advice as a mom, even though I'm a counselor as well. She needs a counselor because she's not going to talk to me. Parents are, teenagers want to rebel against their parents. That's just completely natural. And so that's why professionals can help. So here in Newfoundland, there's a couple pathways you can take. If you have a family doctor, if you are so lucky to have a family doctor, you can start there and get a referral to psychology or Janeway Psychology and start the process of possibly looking at what your child's going through and sharing those self-harming practices that are happening. And speaking to your child in a way as well that addresses the fact there's nothing wrong with them. They're not weird. They're not strange. There's nothing wrong. They're using a coping mechanism to cope with the emotional dysregulation that they're having. So how do we treat that is looking at the thoughts and emotions. It's not just simply saying you need to stop, right? It's not as simple. So again, family doctor referral. You can also go the route of a private assessment. It is fairly costly at times for families who are struggling with, in different socioeconomic groups. It can be challenging to get those assessments. So Eastern Health can certainly provide you that avenue if you need it. And regardless of the route that you take, having conversations around it in your home, normalizing it, and treating it as though, your child is struggling with ideas and thoughts around self, around their self-worth and confidence. So as a parent, we can create positive environments that are encouraging, giving them some space to be on their own. Talking about these things openly is really important. Counseling and talking about it is not punishment. It should never be a form of punishment, like you're being bad. It's about creating a space where they feel comfortable. So again, my heart goes out to those parents and families struggling with this. It can be a bumpy road, but if you reach out for support, it's there for you. There's many wonderful counselors in this city that you can access. And if you want to talk more about self-harm or you have any questions, you can certainly DM me or reach out and we can have a bigger conversation. All right, take care. See you soon.